a very important topic about understanding child growth. Most of the parents are worried about their children's growth, and sometimes they are getting too fat, sometimes they are not gaining height as per the peers. These are all matters of concern. So when does a parent need to get alert in terms of growth parameters of a child is what I'm going to discuss today. Briefly, I would like to introduce myself to all of you. I am a consultant pediatric endocrinologist, meaning I only deal with hormonal issues in children. And my areas of interest are mainly growth disorders, type 1 diabetes, obesity, thyroid, and puberty issues. I am practicing endocrinology exclusively since the past 12 years now in Delhi. And with this, let us straight away move to the topic of today. So, what do you all need to know about growth and puberty is what I'm going to cover in today's talk. Now, whenever we think that our child is short, then we need to have a parameter on the basis of which we are deciding, or a reference curve on the basis of which our child is small or tall or whatever. So for that, it's important that we plot the children on something called as a growth chart, and growth charts are available for Indian children. So no more do we have to plot our children on CBC growth charts, or because those growth charts are based on Caucasian population, and we have a different genetic makeup. Our children grow in a different way, and the amount of spurt also that is achieved during puberty is different in Caucasians as well as Asians. So even amongst Asians, Indians grow differently, and that's the reason we need to plot our children on Indian growth charts. Indian growth charts are readily available on the Indian Pediatric website. You can download, you can take a colored print, you can start plotting your child from birth onwards on those charts. So, what is a growth chart basically? It is like a graph. Okay, I'm going to show you in the next slide how a growth chart looks. It is like a graph which has an x axis in which shows age in years on the x axis. On the y axis, it shows the height in centimeters or the weight in kilograms. And on the back side, we have a BMI chart. So, on the y axis, there is BMI, which is kg per meter square on the back side of the chart. Background of this chart is in the form of a grid, like how graphs are, and universally the standards are pink is for girls and blue is for boys. Now, there are 7 percentile lines on this chart. I will show you all. It begins from the third centile, which is the lowest centile, to the 97th centile. In BMI charts, there are two important lines which our children must not cross, and they are the 23 and the 27 adult equivalent, which are colored so that even the common man can understand that the child is going beyond these lines and it's not okay. 50th percentile on the weight and the height chart is considered to be the average, ideally where a child should be. And any child who is either below the third or is above the 97th is considered to be abnormal. So, in our society, the problem is that only children below third percentile are considered abnormal, but tall children are considered fortunate and lucky. It's not. It's not true. It's a myth. Even tall stature can point towards a lot of hormonal issues or early puberty. That's why tall stature should not make parents happy. Okay, unless and until your doctor or your growth specialist says that this tall stature is within limits, it's fine. But if the tall stature is beyond limits for the parents as well as beyond the population, then it is not good for the child. There is something underlying we need to find out. Now, these are how boys' growth charts look like. So, if you see the boys' growth chart is blue in color, it has the name written here, a place given for the name, the date of birth, which you can put down. On the x-axis here, there is age. On both the x-axis, it is given so that it becomes easier to plot, and it is at every 6 months mark. If you see on the y-axis, on the upper side, we have height in centimeters, and on the lower side, we have weight in kilograms. Okay, now this lowermost line of each graph, so this is the third percentile of height, this is the third percentile for weight. Similarly, this is the 97th percentile for weight, and this is the 97th percentile for height. So this upper graph is for height, the lower graph is for weight. And the lowermost line is the third percentile in each graph, the uppermost line is the 97th percentile. So any child who is either below this graph, below this third centile, or is above this 97th centile on the height or the weight graph is considered to be abnormal, and we need to find out why. Now, this is boys chart. If you see, this is the girls chart. It is very important that you plot a boy on the boys chart and a girl on the girls chart, because they both grow differently depending on their age. So the charts are specific and they are sex specific charts. So it is important that you plot a girl on the pink and the boy on a blue. Now, similarly, this is the pink chart, which is for girls. You might find it very similar to that chart, but the slopes are different. Okay, so that is not for you all to understand. You just have to plot a girl on a pink chart and a boy on a blue chart. It is simple as that. So this is also similar. You have here, which is the weight. Here is the height. This is the x-axis, which gives you the age in years, and this gives you the weight in kilograms on the lower side, and on the upper y-axis you have height in centimeters. Okay, now this is how the back side of the graph looks. So generally we have these kinds of printouts of the growth charts, wherein we have the height and the weight chart in the front, and we have the BMI chart behind. So you don't have to attach different papers in the file. But if you all are going to take a printout, then this you can take it on the back side, or you can take it on the other sheet. Now, if you see the BMI chart, as I had told you earlier, that there is a color coding over here. Here again, x-axis is for years, y-axis is for BMI, which is a kg per meter square. So BMI is actually the amount of fat content in the proportion of fat content in your body. And we have fixed BMIs, like adults have fixed BMIs like 23 and 25 or 25 and 27. But in children, the BMI keeps changing with time. So we cannot give them a fixed value. You have to keep plotting them from the age of 5 years on the BMI chart. Okay. And if the child is crossing this orange line, okay, this is the second last line on the graph, if you all can appreciate, then it is a sign that the child is overweight. Okay, that means now you have to start acting and bring down the weight, because there is a risk of getting metabolic issues like high blood pressure, high sugars, cholesterol issues, snoring, and all that can start beyond this line if your child is above this line. Now, the line above this is the red line, which is the 27 adult equivalent. This is an alarm. Okay, this means that the child has already crossed this line, and once the child has already crossed this line, there is a risk that the child already has these metabolic complications of high sugars and blood pressure and snoring and arthritis and pain in the limbs, knock knees, deformities of the feet. So if your child is above this line, there is no point of waiting. You have to go and see a growth specialist and find out that why this child is above this line and what all issues the child is facing. So this is the importance of BMI chart. Again, BMI charts are different for boys and girls. So this is the girls BMI chart. This is easily available on, you can just type on Google Images, Indian Pediatrics growth charts, and these charts are readily available. You can just take a print and it's easy. You can just start plotting your child every year on these charts if your pediatrician is not doing it. Okay. Now the next thing is that what about the parents? How tall are the parents, and then does the height depend on the parents? Of course, it depends. About 70 to 80% of the genetic potential of height is achieved from the parents. So parents' height is important whenever we are interpreting a child who is coming with short stature or tall stature. This is called as adjusted mid-parental height. So we generally take the mother's and the father's height, and then we calculate with a There is a formula for calculating the target height. Once we have calculated the target height, it means that uh, all the children of that biological couple have to reach that target height, which is one value, but it is not a single value at which every sibling of the family reaches, right? You all also understand that each one of us are different from our siblings in height, by 3 to 4 to 6 centimeters. Okay, so not all the daughters of the same biological couple will be of the same height, like how our fingers are of different lengths. Similarly, all the children of a biological couple will be of a different height, but they have to remain in that range. Okay, and that range is 6 centimeters plus and minus, which is above and below the target height, which is a single value. So, say for example, I take the mother's height, I take the father's height, I calculate the target height for all girls of that family as 150 centimeters. Okay, then all the daughters of that biological couple should reach between 144 to 156 as their final height at the age of 80. That is what it really means. Okay, so this is an important aspect whenever we are interpreting a child's height, and we don't directly jump to investigations and putting the child on hormone therapies. First, we have to do our basic homework of taking the parent's height and calculating the target height. The second important thing is height is dependent on the sexual staging of the child. Nowadays, post COVID, I am seeing extremely high number of cases of early maturity in girls. Like girls are getting periods at the age of 8 and 9 years, which is really early, and the cutoff is ideally 10. Any child who is having secondary sexual characters like breast development, underarm hair, pubic hair, body odor, acne, sudden fall of teeth, sudden change in shoe sizes, sudden increase in height, okay, or sudden increase in hunger. All these signs are of increased sexual maturity at a younger age. Now, what happens if a child is maturing early? What is the problem? Let the child mature early. But there are issues related to early maturity. One problem is that the height attained post menarche is like the final height. Okay, so 99.9% of height is achieved by the first period. So only hardly 3 to 4 to 5 centimeters, depending on the luck of the child, height remains after the first period in a girl. In a boy, be getting a beard and the mustache marks the hallmark of stoppage of growth in a boy. So keeping this in mind, maturity has to occur at a right time if you want that your child should achieve a good height in terms of their genetic potential. Now, in girls, how do we assess the maturity? So in girls, it is the secondary sexual characters like the breast development, underarm and pubic hair development. So we kind of stage these girls depending on in which stage they are, and then how fast they are progressing. We keep monitoring them every 3 months. In girls, in boys, the sexual maturity is measured by, of course, the axillary and the pubic hair, but mainly by the testicular volume, okay, and the size of the penis. So the size of the penis and the testicular volumes changes with every stage of puberty, and we have certain devices with which we check what is the volume of the testes and at which stage the child stands. So the myth that height and puberty are not interrelated, or growth and puberty are not interrelated, is a myth. Okay, they are completely interrelated, and at times they are of a lot of help to us in determining the final height of the child. Now, how do we measure the height? So there is something called as a stadiometer. So this is a type of a meter which is not available regularly, but in our clinics we have this because this is very, very accurate. and we ask the child to remove the shoes and the socks, and then the child is made to stand with 5 points touching the stadiometer, which includes the heel, the calf, the buttocks, the back, and the occiput. So when these 5 points are touching, we bring the scale down, and then we take the height. Whenever the person is taking the height of the child, the person taking the height has to bend down to the height of the child. So I can't be standing and taking the height of a 2-year-old child. I have to bend down to the level of the child and check the height. Why? Because this can avoid errors. So this is how ideally height needs to be checked. Now, what are the factors that determine growth? So, one is, of course, I told you, genetic factor is the most dependent factor of growth. But there are many other factors like birth weight, like children who are born less than 2.5 kilos. That is called as IUGR or SGA babies. So, ideally, we expect that Indian babies should be at least 2.5 kilos at birth. But if they are lesser than 2.5 kilos or if they are more than 4 kilos, then they can have growth issues during infancy and childhood. Nutrition plays a vital role in attaining good final height and in the growth of the child, especially proteins and micronutrients. So, as we know that Indian diets are mainly carbohydrate based, we need to pay attention to how much protein we are adding in our diet, how much micronutrients the child is consuming in terms of vegetables, fruits, and nuts. And the last determinant of growth is pubertal timing and spurt. So, as I told you, that puberty, the end of puberty marks the stoppage of growth. That is why timing of puberty is extremely important. If the child is maturing, say the child has started sexual maturity at the age of 12 years, and the child has started sexual maturity at the age of, say, 9 years, then the child who has started at 12 has 3 years more to grow. You have to understand that puberty, at the end of puberty, the growth will stop. That is why the beginning of puberty and the timing of puberty are extremely important in determining the final height of the child. Now, with this basic information, I'm just going to move on to simple cases so that you'll understand how we plot a child on the growth chart, which you can even do it at home. And when do you need to get alert and see a growth specialist? So this is a girl who just walked into my clinic. She's 6 years old, and she walked into my clinic with a height of 110 centimeters and a weight of 18 kilos. And the parents they just came for a general checkup, and they were just finding out whether this child is doing well in terms of height and whether they need to do anything else for that. So I did my homework. I took the child's height, I took the child's weight, and then we plotted it at 6 years on this graph. Okay, the form of a dot. Do not mess it up by making big targets. You just have to make a small dot and then keep joining those dots. So I marked this child. This was the first visit. So I did not have the previous readings. Now the second thing is, as per our homework, I had to check what is the mother's height and what is the father's height. So I calculated I took the mother's and the father's height and then calculated their target height. And then we came to a target height, which is 153.5. As I told you that the range is plus and minus 6, the range came out to be 147.5 to 159.5. So this is the range, meaning this is the range of height in which all the daughters of this biological couple must reach at the age of 18 years. Okay. So here is how we calculate the target. You have put the target in the form of an arrow at 18 years. So this is where 18 years is. Okay, on the x-axis. You put this on the y-axis out here. You put a arrow, horizontal arrow, and then you put two vertical arrows for the range. Now, if you see this child, if you take this child above and see, you will find that this child is within the range. So this child is very much in the range for the population, which is this graph, and of course for the family as well. So here there is nothing to worry. I just send the patient back, giving them good nutritional advice, and I ask them to see me every 6 months for just monitoring of growth. So here this child does not need any investigation, no intervention required, only good amount of outdoor activity, good nutrition. That's it. Now we move on to another girl who is 10 years old, and she has come to me clearly with short stature. She's the smallest in class and she's bullied in class. Okay, so I plotted her on the chart and she is below the third centile. So, can you all appreciate that this line was the last line of the height graph, which is the third centile, and she is below the third centile? However, if you see on the weight graph, she's in the middle of the weight graph. So here, what is more compromised? Here, we see that the height is more compromised than weight. Okay. So we did our homework. We took the parent's height. We found out the mid-parental height. The mid-parental height was good, 160 centimeters. So if the mid-parental was here, the child was supposed to be somewhere here. And the child is about 10 to 12 centimeters shorter right now. So there is surely something going on. Okay. One, this child is below the third centile, even if you don't know the parent's height. This child is below the third centile. That is the last line. So there is something fishy. Now, the second thing is this child is also below the mid parental height. That is all the more reason that something wrong is going on. So, here, this child we cannot leave alone. We cannot send them back. We have to find out why this child is small. So, we further investigated this child. Okay, and this child either has two three things which clinically we think of as a hormonal issue, it is a syndrome, or it is a bony deformity. Now we move on to a very commonly seen case nowadays, a 12-year-old fellow who comes to me with the parents complaining that this boy is putting on weight every month. Every month, every 15 days he's putting on weight, and they suspect that he has got some tumor which is causing weight gain because the child is always and always hungry. So we did do our homework. We find out the height, the weight. We plotted the child on the graph. If you see, this child is on just below the 97 centile in terms of height, but this child is also slightly below the 97 centile in weight. Okay. So now, can you tell the patient that yes, you have more scope for 5 kilos of weight, then you come to me, because in that case he will cross 97. No, whenever that is the reason, and that is the importance of body mass index charts. Now, with this height and weight, we calculated the body mass index of this child, and the body mass index was 23.4. Now, when we plotted this child on the BMI chart, if you see, this child is above the red line. So, thinking that the child has 5 kilos scope going to reach beyond range and then we would intervene is wrong. Okay, that is the reason we must always plot children on BMI charts, because if they are above the orange line, of course it is an alert, but if they are above the red line, it is an alarm. So now I have to find out whether this child is already having issues because of weight, like high sugars, high blood pressure, the cholesterol issues, deranged thyroid functions. Then does he snore in the night? Does he have joint pains? Does he have any deformity of the feet? Does he have darkness of the neck? Okay, so these are all the issues that we generally find in children who are passing these red lines. So that is the reason importance of plotting a child on a simple growth chart and on a BMI chart. So how much does this cost? It is so cheap. It will not even cost you 2 rupees to plot a child on this chart if you're doing it at home. Okay, and if the child is beyond ranges, as I told you, then you know what to do. Now, many patients come to me for prediction of adult height. So, because some of these girls are modeling at the age of 7 and 8, and they are child models, and they want to pursue modeling as their profession, where of course they need a good height of at least more than 5.5 feet, Then there are certain courses where you need a height of minimum of 165 centimeters, like an IPS course or an IAS course. So all these courses, I do get parents who are concerned because they are going to train their children from a very young age for these courses, and they want to know what is going to be the final height of the child. So is there any way that we can kind of find out what is going to be the final height of the child? So yes, there is a very, very effective way with which we can find out that what is going to be the final height of the child, provided on follow up all the other things also fall into place. So we calculate the predicted adult height by a simple X-ray, which is called as a bone age X-ray, and this bone age X-ray, as pediatric endocrinologists during our training courses, we were trained to calculate the bone age. Bone age means what is the age of your bones. So it simply means what is the age of your bones. The child could be, say, 10 years old, 11 years old, 12 years old. It doesn't really matter. But if the bone age is 9 years for a child who is 11 years old, it means that he's running 2 years behind in growth. Okay, so if a bone age is, say, 9 years, then the child will look like a 9-year-old. Okay, even though he's a 11-year-old. So this is the importance of bone age. Also, bone age is a very important diagnostic tool for early puberty girls. So bone age is running faster than age. Say a girl is 8 years old and the bone age is 11 years old. Okay, that means that there is a 3 years increment in bone age compared to the age of the child. This also marks that this child is going to get into puberty early and she's going to stop growing early. So bone age is a good device. It is not very expensive. We are trained in calculating the bone age, and then we put the bone age in our softwares and we find out what is the predicted final height. The predicted final height is as good as plus and minus 2 centimeters accuracy. So if, say, a 8-year-old child comes to me and I calculate the bone age accurately, and then we put it in the software and calculate the predicted adult height, and it comes up to, say, 170 centimeters, then ideally, if under all ideal circumstances, the child would reach 170 centimeters plus and minus 2. So which is significantly a good method, and it gives you a lot of information and it's not very expensive. So this is all about bone age that I told you all. Now we move on to one more case. These are the cases that I'm getting very, very commonly nowadays. So I'm getting even younger girls like 7 and 8 year old. But let's see this girl who is 9 year old, and she is good, tall and thin, pretty girl. And her parents are not very tall, but they are very happy that their daughter is very tall. So we put her on the growth chart. Now, when we put her on the growth chart, if you can appreciate, this girl is on the topmost line. That is the 97th percentile. In weight, she's in the middle. So, as I told you, she's a thin and a tall girl. Okay. Now, parents are very happy because she's tallest in class. But now, if you see for the familial target height, which is here, so the parents are not very tall. The mother is also neither tall nor the father is very tall. We calculated the mid-parental height, it is just 150. So when we go back on this 150, this girl should have ideally been here where the arrow is. But she is about 15 centimeters taller than what she should be. So this is nothing to be happy. Okay. So this is for all the teachers also who might be attending this session, and all the parents. If your child, especially your girl child, is excessively tall at a younger age, okay, do not feel happy about it. Please find out that why this child is tall. Okay. Now the next homework that we had to do is we had to check what was the sexual maturity of this girl, and this girl was almost ready to get periods. So, as I told you, after periods, she's not going to attain much height. So, practically, she's just 140 now, and say she gets her periods in the next 3 months. How much is she going to grow? 143, 144, not more than that. So, she's not even going to end up where the family is. So what happens is that the parents feel that my daughter is tallest at the age of 9. She's obviously going to be 5'7", 5'8" by the time she's 11, 12. But that's not the case. She will start menstruating early and she will stop then and there. Okay. So do not remain under this myth that girls grow till 18, boys grow till 21. That's a complete myth, and it's not at all true, as especially nowadays. So now a few slides on puberty. So what is puberty? It is when a child becomes an adult. The process of this is called as puberty. Now, whatever happens in puberty is you have physical changes that occur, you have sexual changes that occur, and there are psychological changes that occur in a child. It generally occurs between the ages of 8 to 14 in girls and between 9 to 14 in boys. That is why, if a child is getting any secondary sexual characters like breast development, like axillary hair, like pubic hair development, like body odor, acne, anything before the age of 8 years is an red alarm. It's a signal. Just go to the growth specialist because this is not okay. Okay. And you might just land into periods within the next 6 months to a year, and then you can't do much. So girls can progress in all stages of puberty in just 18 months. Okay. So say I am seeing the progression in 6 months. You can't believe it. Post COVID, the progression has been so rapid that there are just no changes in February, and by June, July, these girls are menstruating. So it is as fast as 6 months to 18 months. So even if a child starts at 8, she will start menstruating at 9, 9.5, which is just in the second or the third class. And at 9.5, what is the mental maturity of a girl to handle periods? It's very difficult because it's not a single event, it's a monthly event for the child. And then once it's a monthly event, the child, first of all, the child looks too big for the other classmates, so they are bullied, so they automatically get away from playing activities. Then during menstruation they are not able to play because of certain myths in the society that girls cannot play, and then they start putting on weight. So it's like a vicious cycle, and that's the reason early puberty is not really good for a girl child as well as a boy child, but more commonly it is seen in girls. So, what is the basic physiology? What happens? So, during puberty, whenever the child strikes puberty, generally at the ages of 10, 11, the brain starts removing the sexual hormones from the pituitary gland, which is the LH and the FSH. This LH FSH goes and stimulates the testes in boys and the ovaries in girls, and then that produces the final end product, which is estradiol, that is a female hormone in girls, and testosterone, which is the male hormone in boys. Now, this final product of estrogen and testosterone will cause the changes in the body of the child, like hair growth, change in odor, acne, getting angry. So they can have a lot of mood swings during these times. They can be depressed. They can keep crying on the silliest of things because there is a lot of hormonal surge going on in their body. And puberty is not an easy time for some children. So it is important that we, as parents and doctors, remain patient. Even teachers, they remain patient with these children. So this is what happens. So the chest is flat, then the nipples start growing a little bit. Then you have little bit of fat below the nipples, and then you have the full adult breast development. In girls, again, the pubic hair development, in stage 3 you start seeing pubic hair frankly, and then by stage 5 it is equal to how it is in adult females. So what happens in puberty? You will see that the girl starts getting pimples, okay, excessively sweaty, feeling hot. Then her height will suddenly start increasing. She'll start getting very hungry. Breast development will start, and hair growth in the pubic area and the underarms. The last thing to happen is getting periods. Okay. So the basic is that any girl or a boy who is having pubic hair development or underarm hair development before the age of 8 years. It's an alarm, alarm, alarm. Breast development before the age of 8 years in girls is an alarm. And testicular enlargement before the age of 9 years in boys. It's not really easy for parents to measure the testicular volume, but at least giving a bath once in a month to children above 6 years is something that we advise, because after 6 years children take a bath on their own, and there is a high chance that you might miss all these initial stages of puberty if you haven't examined your child well. So once a month giving bath to your children is important, just to go through any changes that are happening in their bodies. So in girls, the first thing you have is breast development, followed by hair development, and the last stage is getting periods. In boys, the first thing is testicular enlargement, which generally the parents will not appreciate, followed by pubic hair and penile enlargement. This the parents can understand that suddenly there is an increase in size of the penis, the length of the penis increases, and the last thing to happen is change in voice. So the first change in voice is generally when they pick up the phone, and initially people would recognize their voice, but later on people would say, call them aunties on the phone. That is because the voice is getting from a child to a woman to a man. Okay, so this stages of change in voice can occur, and this is a hallmark that the sexual changes are rapidly progressing. So, as I told you, the physical changes that happen in a girl, so that the girl changes into a woman, and into a boy, so that he gets converted to a man, is called puberty. It is associated with three things, which is the growth spurt, the bone age advancement that I showed you all, and physical changes internally and externally. Now, why do you grow tall during puberty? So, why do you get a growth spurt? It is because these sexual hormones, these high levels of estrogen and testosterone, they drive the growth hormone in your body, and that's how indirectly they cause an increase in height. So suddenly you must have seen this during your own time, that during the 8th, ninth class, suddenly you gained a lot of height, your shoe size changed, your clothes size changed, and suddenly people started saying that within a matter of 6 months, this boy has just shot up. So this is typically, which is called as a spurt, which is called as a pubertal spurt. Care as parents you can take to achieve a good final height. So what all can a parent so that their child will achieve a good final height? One is you have to take care of the nutrition. So giving a high protein diet, amounts of micronutrients which are present in vegetables, fruits, and nuts. So this needs to be taken care of. Second importance is of physical activity. Okay, here I would really need to stress upon that physical activity is going down day by day in children because of increased school hours, because of increased screen time, maybe because of the weather, because of safety issues, whatever it is. But if you are not able to send your child down to play, in the playground without any supervision, then it is better that you put the child in any kind of a enrolled activity, like say skating or basketball or football, so any, or even dance and aerobics. So anything that the child likes, okay, the child can pursue. There is no activity which is better than the other activity, but whichever activity the child is doing, it has to be a good, vigorous physical activity for at least 1 to 1.5 hours per day. Okay. Now, there are certain issues that children can go through during puberty, which I would like to highlight. Like they can have a strong body odor, which can upset them because people notice it, and it's not very good to have this kind of a sexual odor. But generally, with time, the sexual odor goes down. Then they can develop acne, which can upset them. There are so many girls who really go into depression because of acne. Then there are irregular menses that can upset them, because when the periods start, it takes about 18 months for the menses to kind of regularize and the hormonal milieu to stabilize. So sometimes this irregularity can upset them. There is a lot of weight gain post puberty because these children feel extremely hungry. So whatever is in the house, they're like animals, they will eat anything that is available at home. So it's important that during the pubertal spurt, or during, if you're seeing that there is pubertal changes in your child, then you must make healthy food available at home, because whatever the child will see, the child is going to consume, and especially junk food is what they prefer to eat over healthy food. So don't give them a choice, you just have to make healthy food available for them. Now there are certain myths in the society regarding menses, which I would like to clear. So these are from different countries in the world, that girls cannot play during menses, girls cannot touch the kitchen items during menses, girls cannot go out during menses, people do not touch the girls who are menstruating in the house, they are made to sleep separately. So I mean, I'm sure that nowadays people are more mature and they understand that these are real myths. And practically, these all came into picture because during menses you want the child to take rest. Okay, because it is a painful event for the child, and for the child to adjust to the situation, and you don't want the child to stress out during that time. So these were all society made rules so that in some way or the other the child gets some time to rest. But if the child wants to play, if the child feels okay to play, then there is no contraindication to let the child play and take part in regular activities. So another question is, when do you see a growth specialist for prediction of final height? So as I told you, if you all are pursuing certain types of courses like modeling, like IPS, like becoming a pilot, where you need a specific height, then we can use this prediction model. Or you just want to, out of curiosity, know what is going to be your child's predicted adult height, even then it's a good deal, because it's not a very expensive way to find out what is the child going to reach. Now, with this, I'm coming to my last slide, which are the red flag signs in related to growth. So, whenever the child is below the third centile, which I already showed you all on the graph, whenever the child is above the 97th centile, if the child is above the 23rd or the 27th adult equivalent on the BMI chart, which was the orange and the red line on the BMI chart, any movement of a reading, so say you are continuously plotting your child on the graph and suddenly the child has jumped from the second line to the fourth line within a span of 6 months, then even this is an alarm. Any breast development in a girl before the age of 8 years, any axillary pubic hair growth in boys and girls before the age of 8 years. So, with this, if you all keep these things in your mind, you will be able to pick up all these issues much earlier. And whenever we treat these patients, or we can even prevent these events from happening if they reach us on time. So, with this, I would like to thank all of you all for patiently listening to me. And now we can take up the questions. If anybody has questions, you all can put it in the question box. I'll try to resolve them. So, any questions, you all can please type on the question in the question box, and I will take it up for you all. So, I don't see any questions. So, with this, I would like to end this session. Thank you all for giving me your precious time on a Friday morning. Hope it was useful to each one of you. Thank you very much. Have a nice day.